of business organization in which two or more individuals pool money, skills,
and the material.
Yes.
The material is not opened.
Yeah.
I love people who are well-oriented. Yes. What about now?
It's okay now.
Okay.
It's now okay? Okay. So I was saying that any type of business organization in which two or more people or individuals get or pool resources together, such as money, manpower, skills, moment, even time, by the way, is a very good resource, the 4 M's, and share profit and losses in accordance with the terms of partnership agreement. So in terms of agreement, you have agreed that we have made an agreement that we are going to start like this, and this, everybody will bring this percentage. And or when we gain the profits, we shall share them. And also we are likely to share the losses in this manner. Okay. And please, I would suggest we record and share those who succumbed to poor network. Okay, Paul, that is good. And Paul, we are recording, feel comfortable. Now, in the absence of a partnership is taken to be to exit where the participants in an enterprise agree to share the associated risks and even rewards proportionately. So it should be that you agree that when we get all this, we are going to carry out these activities, but we shall share them this way. We shall have to share costs. Not MOH bringing vehicles and the other person can't even fuel them. Ministry of Health can decide to give you vehicles, then the organization like IDI puts in fuel and hires the driver. Oh, that one you have shared. But somebody, you want him to do everything. He gives you a car, he gives you fuel, he gives you the driver, all that, and does the repairs of the car. So it becomes a little bit tricky and hard for them to manage. Now, we see that an association of two or more persons to conduct a business. Yes?
An experience to share.
Go ahead.
I have gone to do a sickle cell screening and testing in a certain community, but realized that we were also tasked to pay for the creating awareness and mobilization of the community, but the LC that is paying for these people to go on for the, if previously, remember, I have to first make them aware of the program when it's going to be, and then realize that we are the one who paid for that mobilization. We also paid for the tents, we paid for the chairs, everything was on us. So it felt spaces. Instead, the LCs would have been using the resources they have to mobilize and even the tents and everything, but realize that they weren't in partnership with us. They had left everything for us, which doesn't actually give us more chance to come back and help those people. Thank you.
Yeah. Now, thank you very much. And actually, such a person, in layman's language, or in Uganda, we say amenya, is just like you really don't want even to interact with such a person because he doesn't have anything he's adding on to you. You are the one doing everything. And actually, this calls for something. If you are both partners, like let's take an example like a home. You have a wife and you are the husband, but the wife is the sole source of everything, starting from food, taking children to school, buying clothes, building a house. You, a man, you are just there waiting for everything to be done for you. Let me tell you what will happen. The woman will never respect you. No one will even respect you in the community. No one wants to interact with you. Leaving you when people are going to discuss important issues, they will never involve you. But where both of you are contributing something. You have left home, you come back when the woman has painted the house. You say, where did you get the money from? That is good partnership. You are somewhere, but a woman has to first beg. I want to go and see my relatives. We lost somebody. Then you tell him, you wait. When I bring the money, you will go. Me, I don't have money. If you want, you go and walk. Hey, he walks 50 kilometers away to go and bury. But if a woman is rich, she will call you when she's at the burial site. Nah, honey, we lost somebody and I drove. But here you are, your wife is not empowered. She doesn't know how to drive. There are 2 cars in a compound. She's just there because you did not empower her. So that kind of partnership where you even feel like you slap her, you beat her, she tells you, I want this, and for her, she cannot speak anything. That kind of partnership is not good. So if you want to live in harmony, you must be in a partnership that is where everybody is mutually benefiting. You remember mutualism in microbiology?
Yes, Mr. Matthias.
So what does mutual mean? Mutualization.
Mutual, this way both people benefit from the relationship.
Yes. So the relationship, everyone is benefiting. How is it different from symbiotic? Yes. I call Mr. Jalu.
I think it's the one where
one party benefits.
One partner benefits, but the other one
But
is
the
not
other one doesn't, because that's cause
Is not affected. It doesn't
exactly
come to the other one.
So at least you can, or that one can be better a bit. But this is a person you are staying with, you are in partnership with. Yes, he's not harmed at all. He doesn't lose anything, but he's giving you some kind of accommodation. But it's like you are just there. I don't know. But in contrast to a corporation, those who engage in a partnership are liable. They are liable for debts incurred by the company to the full extent of their private to their private fortunes, rather than merely to the extent of their investment. So when you go into partnership, just know that this is how I'm going to. Even by the when I look at when someone gives you a job, it's like you have gone into partnership. You have told him, I'm a clinician, I'm a nurse, you are employed. So once you are employed, that means the other partner is expecting you to do something. Now you don't work, but at the end of it, you want him to pay you. So the agreement might be shattered. Now, Uganda's partnership policy was established in the year 2013, and they said that the framework for the partnership dialogue between the government of Uganda and development partners was even launched on 9th December 2014. But this is where they launched the Uganda Vision of 2040 in April 2013 in order to provide development paths and strategies that were aiming at transforming Uganda into a competitive upper middle income country. So the vision of 2040 is implemented through 5-year national development plans, which usually defines the government's medium-term strategic kind of direction, development and implementation strategies. And they see that we had reforms, the key reforms for this policy. We had in 1986 to 1987, we had the seeing a sector collapsed, and the NHLP was welcome during that time. But around 1986, we saw another key reform to around 1989, where the Health Policy Review Commission, where it brought about the consolidation of the existing services and reorientation of health services, or reorientation of services to primary health care. And when it came to the year 1995 or 1996, up through to 2001 or 2000, there was a process of development of the new national health policy and the health sector strategic plan, which is HSSP. But there came in around 2001 through 2004, where they had a a plan, action plan of eradicating poverty. So they called it PIAPI, or you call it PIAPI, Poverty Eradication Action Plan, in 1997. And they had to borrow a lot of it, and they updated it, aiming at reduction of poverty, or they wanted to reduce poverty in most of the countries and other countries. And up to now, they still use that Poverty Eradication Action Plan. National Development Plan came in around 2009 to 2013, but all closely aligned to the Millennium Development Goals, which expired, and they were having that agenda of your health for all by the year 2000, and they were using the MDGs. Right now, we are using the SDGs to have a vision of 2030 achieved. So the examples of other reforms were issues with the decentralization, where services were got from the center, like from the city, Kampala, and they are taken to distant districts to ensure that there is effective delivery of services. And national governance reforms also came on board, and the public service restructuring and how people are getting there. I can see something in the chat. Derek pick a leaf. Why? Why, Jen? Why is Derek picking a leaf? Nanyans can tell us. Jen.
I wanted him to pick a leaf from what you were explaining on how to treat a partner.
like that. That is good. And that's why Rothomio laughed. So Rothomio, is that a laugh or a laughter? I don't know which one is that. Rothomio, could you explain your... But now for Jane, I'm seeing tears. Is that tears or what now? I can see reaction. But Roy, you can also explain.
Tears of joy.
Tears of joy. I like that. Yes, Loy. What about you? Loy, could you talk to us? Is Loy a man, but... Yes, Loy? Roy seems to be off. Now, these are some of the partnership principles. Government of Uganda tends to seek donor support only for programs in the agreed framework. So what does it mean? That don't accept any donor who comes on board. Can I give you an example?
Yes, go ahead.
Look at this. You are a Catholic-based institution, and you don't encourage family planning. Then a partner comes in church and says, please, I have a lot of money. I want to inject the money so that you start using Cyanopress. This one is not in your framework. You remember how people were talking of these gay issues. They want to support us, but they are putting condition that we must also adopt to the gay practice. That is, gayism is not in our framework. So in partnership, make sure whatever you are adapting, whatever you are welcoming, make sure it is within your framework. Otherwise, you are dealing with HIV, but they are bringing donation that is going to deal with the construction of wells. You do not know how to construct wells. You do not have even the engineers or the experts. I don't know that it makes sense. Any experience regarding that? It's like we are doing science courses. Now they bring a program of carpentry or technical drawing. We say, yes, bring it to our faculty. They have the expert to teach the thing. It's like also people of social science or arts, they also say we want to teach science courses, health courses. So they will not manage. Now, to develop comprehensive, costed and prioritized We are sorry, Jane, for how Derek treated you. You've sent it to me directly. So Paul, I don't know. You were sending to who? Oh. But you sent it to me. Derek, would you want to share? Oh, we can move on.
Let us move on.
Let's first move on. We shall share later. Okay. So what I mean is that here, you need to develop comprehensive, costed, and prioritized sector-wide programs, which are covering the entire budget, so that the government speaks with the one voice. Otherwise, if you try to do certain things, you want to go into partnership, but you do not have even expertise to cost the activities and the resources that you need. So you break. That's why you need to have knowledge in what you are partnering with. If you do not have the expertise, even just costing can be a very big problem. Planning and so many other things. So the donors is mainly to ensure all support is fully integrated into the sector-wide programs and is fully consistent with the sector priorities. If it's not going to be consistent with the sector priorities, then it will be very hard. Many people, donors, all come with their agenda and they think it would work out. You need to fit in with what you are partnering with. And to end individual parallel country programs and standalone projects. Okay? The donors usually look for, yes, can I have a project that can, yes, we are partnering with somebody, but this is totally a different project that you can even evaluate at the end of it. But there is no way you can evaluate a project whereby you find people in the middle and you have duplication of services. People are implementing HIV target 95, 95, 95. Then a partner comes and says, yes, I want also to implement mine, but let me also start from here. So you start from where they started. You even start testing those who were tested already. So you count their results as theirs. Will that one be really good?
State of confusion.
State of confusion. And actually, if you get a very good auditor, you will see that you really ate the money. You'll be getting receipts from the finance officer, and you are claiming that this was your money. And that's how these good donors will grasp you or will get you. So you need to look for a partner who will allow you to implement your project from the scratch, and you are able to follow the track, but it's just giving you support and pave a way for you. So once you find that the activities are similar, you better look for a different institution or a different implementation site so that you don't crash. And that's why in the settlement areas, the office of the Prime Minister is there to regulate this. Once you are going to serve the same purpose, when you go to Changwali, Chaka, Luamwanja, those settlements, Bidi, they have the office of the Prime Minister. You cannot implement your project unless you have gone through those people, because you are going to crash. You've just given mosquito net, the others also giving mosquito net. What are you doing? You give fancy as they are giving mosquito net, all right?
Excuse me, sir.
Great.
Excuse me, sir.
Go ahead, sir.
There have been a colliding scenario between the Prime Minister's office and the Minister for Disaster and Preparedness. You look at which kind of partnership are these people having. For example, in the case of the refugees and things concerning the disasters and so on and so forth.
Yeah, and that's when I think we need to bring in the principles of partnership and see who does what and why is he doing it. Is he the one who is supposed to do it? And in most cases, especially when the government is the one giving the donation or giving the support. And I understand that everything that you would wish to do or to implement has to pass through that office. So they cannot go through unless the president knows. And who is helping the president to know all this is the Prime Minister. So that's why the office of the Prime Minister does a lot of things, and then they will be able to actually highlight a few challenges that they are meeting in the field that there is already an organization which is supplying that. Like, let me tell you, we went to the community to give them megaphones. They told us that we have many megaphones that the government gave us. So instead of you wasting your time and bring megaphones, why don't you buy for us batteries? But when we went back to our donor, I said, for us, we plan to give only one megaphone, and we shall buy our own batteries and we put in there. So even if they have for us, we shall go on with that plan. So we thought the money for buying a megaphone was going to be converted into batteries so that people can give. Yes, Paul, your hand is up.
Yes, I just wanted to give a scenario related to what you are trying to explain.
Yes.
In Kotido, last month, we had a partner that wanted to come and support the district with the TB contact tracing. They contacted me as the TB focal person, and then I had to liaise with my direct supervisor, that is the DHO, on a partner who wants to support us in contact tracing for our TB patients.
Yes.
Now, when I informed the DHO, he told me, no, he has never heard of that. And he said, let me consult with the cow. Then he told me that no, that partner has not come to the district. They has not reported to the district. We have never had an inception meeting with them. So there's no way we can allow them to invite our health workers to go out for a training on or orientation on contact tracing. So, and that program is suspended until the inception meeting is done, because CAO's office is not aware, DHO is not aware, the RDC is not aware, LC5 is not aware. So they said, no, this is illegal for us.
Yes.
So I think it is in line with what you are trying to explain.
Yes, I think, thank you very much for that.
Yes,
Rebecca, your hand is up.
Yes.
Richard, you go on, Richard.
I want to relate the kind of the discussion you're not getting me?
We are getting you clearly.
Yes, I'm saying I would relate what you have been talking about, the issue of megaphones, sending them to the community, and then they say they already have. I would attribute it to maybe poor project planning from the donor side, whereby when he was prioritizing how to support that community, it didn't go down to first assess what do these people have and what they don't have. That's why maybe ended up forcing in the megaphone, because it was already passed, maybe even some funds already allocated for that.
Yeah, that is true. And actually, you are right, because in project planning and management, I learned that we need to listen to each other, even if you think, because, and people take a document, that document which they use for implementation, a protocol, as though it is a non-living document, that once they have put S, it should always be S. It should be just a guiding tool that you can always change, because it would be better to ensure that there is sustainability rather than taking up issues that are personal, that one wanted also to cause some visibility. They thought that maybe when we take only batteries, then there will be no way that we shall have an impact. Like, people look at results in the form of what have we taking photos, megaphone delivered, but has the megaphone worked? Okay, district politics says so, and the Rasul is saying in regards to megaphones, community needs assessment was not done. Yes, which is a challenge among many NGOs. Yeah, by the Rasul, we did an inception meeting, actually what I could call inception or pre-visit. I think pre-project, we called it what? Pre-project visit before we started, and we were telling them, orienting them about the project, and they told us that feedback. And when we took back the feedback that people have megaphones, they just need batteries, the other project officers said, no, we cannot change. We have already procured, or they have already put in the order, and they will say we are channeling resources. So we did a community situation analysis before we implemented. It's about poor leadership in the Prime Minister's office. Hilary Onek should be empowered to do her job. Paul Chilumina has added. That's very good interaction. So you need to increase the level of delegation to country office. You see, when you look at, let me give you another example. In Mbale, there is an emergency operation center, EOC. Okay? You know that?
Yes, sir.
Now,
Actually,
if you, yes, go ahead.
Yes, I was saying that it is not only in Mbale. Nowadays, they have established this regional POSC. So even for us here, we have Arua.
That is good.
It's been headed by IDI.
Very good. Now, when you have such an office, the other time now we are bringing a project to Arua, we shall be having such emergency operation center helping us, or that team helping us to mobilize the community. And now, if they send you to an area where IDI does not have any office, you find a lot of resistance. Bringing these people on board to do what you really want, coordinating with them, it will be very hard. Because when you look at some areas like southwestern Uganda, which involves Kabale, Kisoro, Lubanda district, Ruchiga, Lukunjiri, and Kanungu, I was given those 6 districts to coordinate a project for IDI. But the challenge I got was that we did not have any emergency operation center or a contact office that these people knew IDI that is coming. So it was very hard for me to penetrate and liaise with them. And actually, you find that one of the districts did not help me so much to implement the community dialogues, and we were paying for them. So we had to now to redirect the community dialogues to another district where people could do very well, okay? And we did also another thing where we also did during the pre-visit before the project started. We had to agree that each district will have its own radio talk show. But when we came back on board, we had, say, each region, we are giving you only 3 radio talk shows. Now, the challenge was someone cannot come from Chisolo to come and give a talk in the radio voice of Chigezi, that is in Kabale. Yet we are supposed to give them a per diem. But their issue was saying, no, our people don't listen to the voice of Chigezi. And so we had to look for people to represent them. But we don't know whether people of Chigezi, Lukunjiri, and those of Chisolo, those extreme districts, and Kanungu, could at one point maybe turn on and tune in and maybe listen to this voice of Chigezi. So you can see that when you delegate, why I brought this point is that when you delegate the country offices, you will find that partnership moves in very, very fast because they know whom they are dealing with. Than you coming from UK and you start from scratch and you want to carry out everything, even you don't know the language, you don't know the culture of this place, you don't know whom to approach to, where to take a business. You will jump our office and say you went to Museveni's office, you thought he was the one to help you, yet you jumped to Nabanja. Yet you would be the one to say, go ahead on behalf of the president. Does it make sense?
Very, very well. All
right. So these partnership principles were actually formulated under the leadership of the government, and in discussion with the highest in-country donor and civil society representation, and they had to come to an agreement to that. Now, we have what to call health and local government contexts, where we have partnerships between health and local authorities. They tend to exist in terms of health protection, in terms of emergency planning, in terms of health promotion, in terms of health improvement, and health inequalities. So the government work in harmony together with the health sector to ensure that as they are protecting the community, people are well protected. So health protection is one of the biggest spheres of health promotion, So we normally see that every time they are coming into partnership, they want to agree or they want to come to an agreement. How do we protect the community? In case there is an emergency preparedness plan, how can we do it? Who can be helping us? You normally see UNHCR. The other time when I was in Changwale, I saw buses and buses bringing refugees into the country. And I was looking at the partnership. We have WFPA. Is it WFP or World Food Program coming together with the UNHCR, with other partners? So you find that people are working together. And actually where there is a lot of partnership, like when you reach a camp, you will be shocked. These people are getting services from various corners, from various agencies. This one is on family planning. This one is on antenatal. This one is busy handling emergencies. This one is on circumcision. So you find that services, you don't suffer, that you provide other services to the community. So all these are always important for us to handle. Any experience regarding that? Okay. As we move on. So we see that the elements for an authentic partnership for health looks at this. Now, you need to ensure that you do a cross-examination and be sure with whom are you going to engage with. And you must be engaged in activities that are going on and evaluated. And what makes the partnership work? Sustain authenticity is very, very important. And also achieve the change they want to see in their community. So you must have in the first place the guiding principles of partnership. What principles are guiding you in order to move on, to go into agreement with one organization or with a partner? Then the quality process. Who is overseeing the implementation of these activities? It is not a matter of getting a partner here who is going to exploit you. There must be somebody observing the standards of who is coming. That's why organizations, donors rarely give money to individuals, because they don't know who you are. You may just want to take away the money and you disappear. They will always want you to get attached to a university, to a credible institution with a lot of, faith, with a lot of, I could say, trust, that they know tomorrow the organization will not go away. There is the issue of sustainability. And they are looking at the meaningful outcomes. You don't just tell them, you see, when we do this, I think it will come out like this. No, tell them what exactly you want to achieve at the end. And eventually, you should be in a position to transform the experience from one project to another. That's why they usually give even certificates at the end of the project. That in partnership with the HIV/AIDS and this commissioner, in partnership with the Ministry of Health, IDI, we give this certificate to Derek Kaziro for having completed the project successfully about maybe sickle cell screening and detection. So that one, it is transformative in nature, that the experience can be transferred from one project to another. So they are not meant to be prescriptive or adopted verbatim.
Excuse me, Sir,
but rather, yes.
Even not only transfer it to another project, it can be used for replanning.
Yes, that is true. Exactly. Thank you. And what I'm saying, these guiding principles of partnership, they are not to be prescriptive only, that you are just describing or adopting them verbatim. That's the way they are, but rather they are to be used for discussion or as a model for developing one's own principles of partnership. And the partnership is always formed to serve a specific purpose and may take on new goals over time. So usually the partnership agrees upon mission, upon values, goals, measurable outcomes, and even processes for issues of accountability. And yes, Rebecca.
I'm sorry, I didn't put my hand down.
Oh, sorry, I said when it came out, I thought you wanted to add something. And we see that the partnership usually agrees upon the mission. You must agree with the values, the goals, and measurable outcomes, and the processes for accountability. So where you find that you don't have a similar mission and the similar values, so you should go into a community, we should go into a partner organization when you really know that you can fit in their mission. Just as I told you, their mission is to ensure that they reduce HIV. Now, for you want to partner with them, but their mission is to make sure that they reduce sickle cell. Now, you are not going to be at par. Their mission is to ensure that every home plants a tree or plants coffee. Your mission is not for planting coffee. You do not have expertise in coffee. You will not meet it, and you don't value coffee. Instead, you value HIV. Do I make sense?
Yes, sir, it makes sense.
So, and we want to go into partnership, but the outcome cannot be measured. Yes or Mona? Amos, your hand is up. No, Mona, I think the hand is up by mistake. I've lowered it down.
No, not by mistake. Are you getting me now?
Exactly, you are clear.
Yeah, I was trying to bring some issue on a partner that we are working with. Actually, during this period of COVID-19, where the partner who was just selective, he only handled some number of sub-counties, but not all the sub-counties. And bringing up issues of, you find it becomes very difficult actually to handle. And yet the COVID-19 is affecting all the sub-counties, not only the 5. I was seeing this one as a big problem in line to what you have just said.
Okay.
Yeah, that is what I wanted to say. Thank you.
Okay, thank you very much, actually. But the challenge would be sometimes it is the resources that are limited that maybe probably could not handle some districts or some sub-counties. And usually they look at those which are hotspot, the ones which are at a high risk. And actually who guides you? It is the Ministry of Health. Depending on the problem that people have, they will tell you sub-county A and B, they are the ones which are highly at risk. So that's why maybe sometimes they could go and fit in there. And the relationship between partnership or partners and the partnership is characterized by mutual trust. You must trust everybody. Just like I can trust you people and say, yes, Omona, your hand is again up.
Doctor, you can proceed.
Okay, that's good. So you must trust each and everybody. This business of giving money to the wife and you are not trusting her whether she will manage the money very well, it should stop. Otherwise, you will get stressed for nothing. You trust her and you have some trust in that. You are with her, but she will not steal the money. If she eats, it is up to her. She isn't she your wife. Oman, again, you want to talk about the wife? I do. Your hand is up again. Oman, I want to give experience about your wife.
No, doctor.
Which one do you want to give about? I'm just seeing your hand again up. That's why I asked you.
It's okay, doctor. Let's proceed.
Okay. That's good. So what I mean is that even when you are working with an organization, I don't want to work for an organization where they don't trust me. They even can't trust you with only 10,000. Someone cannot trust you with the key to go to his office because you are doing certain things there. Either you are thinking of witchcraft all the time, you are thinking of stealing. You see his document, you come and pick it and hide it. So all those things, someone should be like you are trusting each other. And respect. If you don't respect everybody in partnership, you will collapse. You should respect what he has done. Project implementation is not easy. The moment you don't respect your friends, the moment you don't respect your fellow partner, and what brings the issue of not respecting you, the other thing I started with, because both of you, one of you is having a lot of money than the other. But if the moment you have the same money, almost earning the same way, almost having the same qualifications, you will be like at the same level. And this business of marrying someone of 50 years and you are 25, they will cane you, boyagala sugar daddy, because he's seeing you as the daughter, a granddaughter, moreover. So why doesn't he beat you? But where you see 5 years and the other one is maybe 25, this one is 24. You're almost the same. So if someone respects you as a sister. So even in partnership, when I do something, what is going to cause the disrespect is that you bring a lot of it, you are contributing 70%, so the other person is bringing 70%. The moment you bring 70%, the other person who is bringing 30 is going to be disrespected. When he stands to speak, he says, "What are you talking about? We are the one who contributed much. Can you sit down?" Do you know how it is painful? And you should be genuine in what you are doing. Be genuine to your partner. Are you genuinely doing it, or it is just for the sake? So if you are genuine, you will even call her and say, "I've gone here," and she will accept. But the moment he doubts you, even if you tell him, "I've gone here," she will never trust you and say you have gone somewhere. That's how also partnership is. They are calling you, you went with the kind of field, but because the days got finished, they didn't finish the days, so you hide the car, and they have seen it somewhere. They are calling you, they want to take you to another district to ensure that the implementation goes on. You are not open. Are you really genuine? Where are you now? I'm here in Kabal. Are you sure in Kabal? Okay, it's okay. When you come back, we shall go. So they hire another vehicle. And you must be committed. They call you, "Come and we go and work." No, I'm just come back from the field. I'm not going back. You look for other people. Then you are not a good partner. Something in the chat. Once trust is broken, it is over. Paul, thank you very much. Now, the partnership builds upon identified strengths and assets. If you have a strength, even if you have a skill that you know that they cannot do, my dear, that is enough. And the strength can be money. You have the money, they will always lean on you. They always say, "We want to partner with so-and-so." You have the knowledge, you have the skills, you have the assets, you have vehicles, you have, I don't know whether a vehicle is an asset. You have office premises, land, but also works to address needs and increase the capacity of all partners. Now, the partnership balances power among partners, and it will enable resources among partners to be shared. On top of that, partners make clear and open communication in an ongoing priority. So if you want your partnership possible to understand each other's needs and self-interests, but above all, developing a common language. The moment you cannot develop a common language with a partner, as Paul said, it is over. You will never interact. And you learn to swallow certain things sometimes and swallow some pride. working with cliques and being suspicious of each other breaks partnership. Thank you, Paul, for addition. Because let me tell you, the moment you feel like you don't understand him, there are people whom you will be with in implementation of a project, and for them they take it as if they are the only ones who know it all. For you, whatever you are saying is rubbish. Now you need to learn him. If you understand him, you'll work with him. Take some time and say it's okay, let's do it that way. Once it fails, then you bring your plan B also. And don't always be negative on whatever someone has brought, it can work out. You try it out, you never know. Principles and processes for partnership are established with the input and the engagement of all partners. Don't leave out some people. When you call for a meeting and they don't come, when they come the next day, they want to take you back. Especially when you are making a decision and conflict resolution, you need everybody on board. There is always feedback among all stakeholders in partnership. And what we are aiming at continuously improving the partnership and its outcome. But the moment you take long without giving feedback, you don't want to give reports. You don't tell us what you got in the field. You don't tell us the challenges you are facing. You are struggling alone. At the end of it, you don't have a report. So you need to share the benefits, having accomplished tasks that you set as a partnership kind of relationship. Because we see that partnership can even dissolve. And when they do so, you need to plan a process of closing it up. And everybody lives in harmony. That tomorrow they can call you on the next project. The moment you just run away, no one will ever. It's like a person has come to your home to visit you. She slept at home. She leaves the home without you knowing. You come back, you say, where is so and so? That she left. So which kind of a person am I dealing with? Is he a ghost? You are sleeping with somebody in bed. You wake up in the midnight. Someone has already gone. Where has she gone? In the middle, around 1, the person is not in the house. You check around, you find the door open. And as you are there, she comes back very cold. She's a night dancer. Partnership. Consider the nature of the environment where they are existing as principle of design, evaluation, implementation, and sustainability. And they consider, in partnership, you should welcome every kind of knowledge and life experiences. People have vast experiences. He's telling you we did it like this last time and this is what you got to say. Let's try our luck. You are going to go into problems. Remember, partnerships have agreed upon missions, values, goals, and measurable outcomes. That one I even talked about it. At the identification stage, developmental stage, and the maintenance stage. And also the sustainability. Okay? So remember, all these I've talked about them. All right? These principles I've talked about them. Do you agree?
Yes, sir.
Exactly. The other one was like a list, but I think I've explained them. Now, there is what we call quality process that are related, or where we have a relationship that should focus on. Being open, being honest, respectful, and following the ethical guidelines, trust building, acknowledging history, what really happened in the past. Because we told these people, we are going to conduct radio talk shows, and good enough here, they are accepted. Because my first experience is that we started booking radio talk shows very late. And now we reached a moment that the project was ending and they couldn't procure airtime for us to give radio talk shows. We had planned very many in various regions, but we ended up giving only one in Radio Kabos. Now, this time I'm happy that the next project, once we told them that please book early and make sure you start procuring airtime, by the time the days come for radio talk show, things are ready. And that's how it was done. Here we had 100% radio talk shows held. Of course, with the challenges, as I've shared with you, that they wanted every district to have, but they were not enough. Yes, Rebecca Richard.
Sir, I want to inquire if maybe like the way you are saying it, if the project has set its programs to be implemented in a certain area, and then as it is getting in its select times, it begins out foregoing some other programs like what you are saying on the radio. And I was going to give an example. So there's a project here in Kimale. Those people are supposed to be bringing in some methods, but you find they are not bringing the method. They are using another project that is bringing in the method, but taking the report. They come and take the data when they are not providing the methods now. So is there any way the district can intervene to at least try to look for those programs that have been physically implemented? Maybe they pay in the form of cash if the project is ending.
Yeah. Okay, thank you very much. I will teach you something when I think they will teach you also in project management and planning. There is what we call no-cost extension. Have you ever heard of that?
No.
Whereby the project had its money already in a finance, it is untouched, but the timeline or the time was not enough to implement all the project. The money is still there for implementation. So you write a letter requesting the donor to allow you extend the implementation, but the donor is not going to add you any cost. We call it no cost extension.
Now, so if the project has ended,
yes,
and that money is still there, does it? You are saying it? You allow them to extend so that they can use that money?
Yes, you allow them to extend, and you make a what? How do you call it? An application for the no cost extension, not low, no, N-O, no cost. You are saying the donor gives you opportunity to continue implementing. It should not take away the money, but it gives you time to implement the project, that the activity that you failed to implement during the period when it was supposed to be.
Okay.
Because actually the need of that project is still on, but because time was not enough to meet all the activities as you had planned, then you ask for what we call no cost extension. So the project manager, and why it's like it so much, these Ugandans are the ones who are strict. We gave you 3 months, they're over, you go away. The only thing they may not give you is the salary, because they had planned that your salary was going to be for 3 months and you have used it.
Okay.
So what they do is that the money is there. So what you do, how do you benefit? By getting per diem, the one you have been going to go to the field. So you are getting per diem money as your motivation to make sure that you accomplish the task. Does it make sense?
Very much, sir.
Yeah, because this one happened to me. The project came to an end. 3 months were elapsed in the first COVID-19 lockdown that we got. So I got a 3 months project. When we implemented the project, it reached around October when we had not completed it. So what they did is that they asked for no cost extension of 1 month. My salary was over. They couldn't give me more salary. But this extra month, all the work I was fitting by getting per diem. And every day I could work, they could give me like 140. So that could be good money as per diem. Your work is to ensure that you go as much as possible in the field and then you cover up. You don't work for free otherwise. You'd be breaking. Does it make sense?
Yes, sir.
Oh, great. That's good. So that's why I brought in the issue of acknowledging history. When people are telling you that last time and by the way, when you start working with the project, then that means you are the right person to be looked for. They don't want to get somebody who is totally new on the project. He doesn't have experience in that regard or in that area. If it is about risk communication and you've grounded yourself in risk communication, wherever they are looking for somebody who can carry it on, you are the one with experience. The first project, you will do it poorly. But the next project, you will be now focused. You plan very well and you will achieve the objectives. So you must have commitment, as we already said, and committed to what? To mutual learning. Be able to learn from each other. However much it is a VHT, a person who has never gone to school is telling, don't dig a well there. That route is for the ghost. Now you continue digging a well there. The water dries in one day. What will you tell the donor? They told you that where you are going to dig a well, it has evil spirits. Whoever digs there dies. Now you also dig and you kill. You remember this house near Sivambi, which killed many people. Now, if let's say you are the engineer and they are telling you, please don't take people there, would you take your son there? And they are telling you that place is deadly. Now, anybody who is going to construct their house may fear and is an engineer. Yes.
Yes, there is something that I call Kajkeji. So in that area, there is a business that Uganda and South Sudan are doing between Sudan and whatever in Uganda. So that business, they go and cut down these big trees. They call them logs. So that they sell them to these those agents. So when these Ugandan people go there and they ask about the, certain village people, they say that we need to buy some trees. And then that area, there was a certain guy. And that certain guy was not consulted and he is very powerful than anybody in that area. So what these people did, they went and paid the money to these people. When this powerful man didn't know that the Ugandan pay the people, these people, and then they have to go at a certain hours where this guy was not aware. They cut down the tree and the tree was very big. They cut down the tree, even the shape they cut in two pieces. After that, when they cut in two pieces, just a minute like this, the tree stood up and then people ran away from there.
So
it was a scenario that yeah.
So you can see all those stories can be there, okay? And those things are there. Like you have heard what happens to Nakaima tree. You go and cut it and see this one in Mwende. You will get challenges there. So they are telling you don't put any business in Nakaima's area. And for you continue to put there. And you want to camp there and the people come for family planning. They will fear to come. Sharon has even laughed. Sharon, yes, that is good. Sharon, would you want to share? Even Chirumira has laughed and he has turned his neck and his head down. All right, that is very good. So, and let's have something to share with us. Now, when you look at meaningful outcomes when it comes to partnership, there must be tangible and relevant to communities. We should be seeing the results. You should be able to say, yes, here we are seeing this. You've eliminated the health disparities. You have created affordable housing. You have closed the gap of education. And you are now changing the rural economy. It has been poor. People are now rich. People are driving. People are riding motorcycles. Everybody has. Actually, when I went to Chambari settlement, I was shocked. I asked my friend that, hey, how come that people here in the settlement have what? Iron sheets. He said, no, go away. Those are not iron sheets. They have this clean canvas, which is white. You may think from afar it is iron sheets. I don't know if anyone has been in Changwari, Chikube district. Anyone who can bear me witness? Hello?
I think there is none.
Or no one? Okay. Now, there is, when you talk of transformation in partnership, there is either personal transformation, it could be institutional transformation, but it could be also the community. So actually, transformation is including self-reflection and the heightened political consciousness. Individuals, you see them changing because of your partnership that you have brought. Working together with people. I cannot work with people and I don't pick something new, unless I will choose something, either leadership skill. We've been working with a team for 3 months, but we have never seen each other physically. But people are working distantly. The other one is in another region, another in another region, but we just meet on Zoom, talk about it. They say tomorrow you are going, even that day you are going, you don't meet each other. But you continue working and learn from him or her. Institutional transformation, changing policies and systems of that institution. Partnership can actually change the community through community capacity building. They teach them. But of course, we are likely to also have transformation where we shall change science and the knowledge. How knowledgeable is the community? How knowledge can be generated? How do we disseminate the information? How is it going to be used, valued, and what constitutes all evidence and ethical practice? Even social justice is always part of transformation. The benefits. Jenny, you want to join my team because of vast experience we are trying. Jenny, we shall talk, don't worry.
Yes, I work in Changwari.
So taplin is the one which is used. So when you look from far, you may think they have iron sheet and say, hey, people are rich here, yet they are in a camp or they are in a settlement. Why the potential. Potential. It means the guy is able. That is the meaning of the song. He can do anything that you want to get from him. Working with other organizations can be cost effective, my dear, because it will enhance the credibility and reach of your program. The message will reach the community very fast. Is there the need for public health institutions to seek out partnership or partner organization to reach particular intended audiences? Do you think so? And if you think so, why? Let me give you an example.
I would say yes. Reason being, due to even the limited resources and experience that public health has, public institutions have, they need these partners to help them, for example, share these experiences. That actually, things to do with health is some practical, actually more practical than theoretical. And even it's diverse. So it varies from place to place. So someone needs to be there, for example, the experience, then look at the fund.
Who is there that I can partner with? You sit down and discuss. Consult friends, consult colleagues, and always have partners, have friends who matter. You are there taking beer, but someone tells you that is this organization. It deals with the infant mortality, or it deals with the children with disability. And I said, hey, first wait, what are you talking about? Do you have that? I can have that one in my clinic. Where are they? Give me their address. Like when I went to, there was a project I was working on for Maudime. It was for child disability. And I went to this side of Luwero. Is it? Yeah, Luwero. When I went to Luwero, they told us to look for CBOs, community-based organizations. Those of you who are in Luwero, you know SOS? Anyone in Luwero? Hello?
Yes, sir.
Very careful. Do you know SOS?
Is it a source, the one in Wakiso? Or is different?
It is different. The other one is and many people confuse it with that one of Wachiso. But there is the one of Luwero. Yes.
But what of there maybe
village
do
in
they work
Kachiri.
on the same?
They have the same thing, but the other one is a Christian-based organization. If you have there, you can put in SOS in Luwero.
Okay.
Now, why I'm telling you that is, it is called the Sufficiency of Scripture Ministries, something related to that. Now, we were shocked when because we were on that project and we were trying to interview how our project, we were doing an evaluation. Yes? Let me put on my, where am I? Okay, I think it is not so bad. I wanted to show you on my video. Okay, let me Google here, then I show you what they do. You see, somebody, Rebecca, what you asked is basically what I'm doing. You know, where a younger one knows is where the rain rains. Is it that true?
That's good, sir.
So you will not know until you've gotten somebody who is directing you. So to get a partner is not a simple thing, as one may think. Let me get here, source in Luwero. So let me Google something. So when we reached there, these people had a lot of appliances for children with disability. And when I talked to the director, he's a white, and he told me, people to partner with. I get shocked. So you people, since you have experience in child disability, you are going to help us. We found that they had the wheelchairs, they had these, how do you call them, scratches, and the village with child disability, but they cannot have appliances. So I see my screen where I'm Googling.
Yes.
Yes, it's visible.
So I've put source in Luwero. Okay. Now, you see there is Source Children Village, Uganda. This one is the one in Wachiso Kachiri. But there is Source, this one. Are you seeing it?
Yes, sir.
Luwero, it is 7. And you see this is their project, all of it. I don't know whether you see sufficiency of scripture. And by the primarily, for them, they are training pastors. But all their staff have been built houses. When you get a job, you work there, you stay there. So, and for them, they train pastors. They come and stay there for a month. And they told me that a pastor to study, he pays only 30,000 school fees. I said, what is these people doing? 30,000 as school fees. And the pastor is trained, he reads the free books, and is given accommodation, is given food. And they are looking at this resources. They say, let me show you this. When you click on resources, I don't know whether they can have. So keep up with what the ministries are leading. Let me go back here and about us. Let me see. I think.
Yes, sir.
Maria, leave me alone, Maria. Okay. So we come here. You can see that's their place, and they say sufficiency of scripture ministries exist to strengthen lives and communities through Christ. And we believe that the most enduring avenue for personal and collective strength comes through bringing scripture to life in Christ, this church. Our commitment is to establishing and shoring up the spiritual and physical walls of his church throughout East Africa. The heart of our ministry's work lies in the Ugandan community of Kubamitwe, where God is changing and shaping lives at every time. Okay? So why I'm saying so is that these are what our hand in the change. Gasibe. Okay, so why I'm saying so that it should be somebody who is directing you. For us, we are directed with a person with a disability who told us there is a place called Source. You go like this and this and you reach there. And you can see okay, so I think I've answered you, Rebecca. Rebecca, your hand is again up.
Yes, you have, sir.
Okay, great. So it's something here which I want to show. I think the screen.
Yes, sir.
So we see more credibility for your messages because the intended audience is considered a potential partner to be a trusted source. We see an increase in the number of messages your program will be able to share simply because you have many people who are supporting you. Additional resources, either tangible or intangible. You can even get volunteers and the added expertise where you get training capabilities. There is a possibility of expanding support for your organization's priority activities and co-sponsorship for events and activities. So there is benefits of working.
You have not shared the full screen.
Oh, I've not shared the full screen. Sorry for that. What about now?
It's okay.
Okay, so these are all benefits like usage of resources, culture and ethos. You achieve shared goals, share costs and risks. You avoid duplication and wastage of resources and activities. You combine skills and experiences, streamline systems. You create shared learning and training experiences. You try to encourage innovation and creativity. You again also build relationship for the future and remove barriers. Okay. So better experience and outcomes for the service users. You join up services, you advise and get information at a single access point, joining up referral processes, signposting across services or agencies. You find somebody just writes a signpost with very many partners on one kind of signpost, saving time and effort and increased satisfaction. So common features of strong partnership, relevant people. Whoever you meet, very important, very strong. That everyone whom you say, so and so is my partner. It's like saying, my husband is so and so. You don't even fear to mention. There are people when you move with them say, but the batano to go mwami wabo. So you are not a relevant person because you don't do anything for her. She instead does everything for you. So how will she introduce you? But you see people when they come to the party, they give a husband a chance to talk. Say, my sweetheart, my better one should first greet you a bit, then I continue. That means she's important to the man. Yes. Shared information and processes. If you have information that you have shared with the team, it implies that yes, you are benefiting from each other. And you have reports where everybody has signed in partnership with that. You've seen many people when they are opening up a project, they get a board, like a whiteboard, and they sign on it. Everybody puts his signature. Meaning that inception meeting that you had, you agreed, and all of you have a clear vision and priorities, and you know where you are heading. There is what we call magic ingredients in successful partnership. There must be commitment, proper communication, and above all, you must trust each other. So if you embrace these three, then you know your project will be successful. And when you are building strong partnership, these are the practical steps. Make use of the local contacts, people who are in there. Let him go ahead, or her. I don't see any hand, Derek. Was it a ghost?
It was Dorian. Dorian's hand was up.
I think she was learning how to raise up the hand. Okay. We are saying that if you want to build a strong partnership with a given organization, make use of the local contacts. And you see our friend who asked, once you got the ground and you want to look for a partner in that district, people will tell you, you are looking for what? You just got that building and meet so and so. You will have reached. You've made use of local partners or local contacts. Be part of the local networks and partnerships. You find people put on WhatsApp groups to solicit funds for wedding. Someone just leaves. Now, when will you get a partner? People don't go out. We are busy now here. For us, we are deprived of life. Busy teaching since morning up to evening. When will I go out and I enjoy also? Oh my God. Understand partner roles and responsibilities. And make sure that the partners are aware of the roles of the environmental health. Share information and organizational plans. Identify shared priorities, the win-win situation. And make sure you communicate often. Okay? Follow your word of your power. Then you review regularly and monitor outcomes and celebrate success together. Don't celebrate success alone. You start telling them, if I wasn't the one, she wouldn't be there. I'm the one giving her everything. You get government, key stakeholders in health. We have government, non-government organization, community-owned resource persons. We have volunteers, community members, we have health workers, and we have public health officers. All these can be key stakeholders in health. the future moving forward. Partnership. Strong partnership, working users resources more efficiently. Thus, when things are more challenging and uncertain, it is essential that working together remains a priority. Necessity is the mother of invention, as per Plato. By working together and sharing our resources, we can achieve more than if we work alone. I thank you very much. So can we have a break, Derek, for about 10 minutes?
Sure.
Yeah. So thank you very much. And that is partnership. You are free to explore and read the other materials about partnership. You will enjoy and you will be able to apply this in your day-to-day life. I wish you well as we go for break.
Thank you.
Yes.
Sir.
Okay. Thank you, sir.
You are welcome.
Resuming at 4:30.
That's fine. And we shall do for 30 minutes, then we'll go for other things.
Yeah, there is money.
I like that.
So far 2-0.
My name is Dr. David Musoke. I'm a lecturer and researcher at Makerere University School of Public Health. I live in Wakiso district in Entebbe. My name is Dr. David Musoke. I'm a lecturer and researcher at Makerere University School of Public Health. I live in Wakiso district in Entebbe, and I work with committed workers who brought me in this community today. And the background of the committed workers, or CHWs as we normally call them, is that in many of our communities, access to health care is not as much as we would have wanted, especially in terms of getting the health facilities. So for that reason, the Ministry of Health many years ago felt that communities should have people selected by their residents who have been trained and can support in health care generally. So health care includes health promotion, so health education, mobilization of the community for public health interventions, be it immunization, distribution of mosquito nets, treatment of childhood illnesses, and many others. So these volunteers play a very big role as the first contact of care to the health system, and also play a link between the community and the health centers. And that's why one of their roles is to refer patients that they can't manage to the health centers so that they can get further care higher in the health system. In the Ugandan context, committed workers are volunteers, and we normally refer them as village health teams or VHTs. The volunteerism, of course, has its issues as you'd expect, but over the years, we've realized that despite being volunteers, they still do a good job. But if you support them in a number of ways, including enhancing their training, motivating them, with small incentives, sometimes not financial, a simple t-shirt, gumboots, umbrellas, sometimes makes them feel appreciated, and many times they perform a bit more than those who may not have some of these. So they do a great job, but with a little support, they will probably do much more. So as you would expect, a health system is quite broad, and it has so many building blocks, including governance, including financing, including human resources, including materials and supplies, including information. I must say, in all the building blocks in the country, we have challenges. If you talk about governance, we realize that there are a lot of governance issues. Many years ago, as an example, we had of a lot of resources that had been given to Uganda to support a number of diseases, including HIV, malaria, and tuberculosis, which were not managed well. At the end of the day, the beneficiaries didn't receive the funds, and the donors later on pulled out the funds. So you can imagine a country that is struggling with resources to have a donor pull out resources that are meant to support. So governance, certainly there are challenges. If you talk about information, again, as a national health system concern, I don't think we've done a great job in terms of collecting information regarding health, right from the community health workers to the highest level of the health system. If I talk about financing, again, very big issue. Uganda is a developing country. We've not made the 15% required for budget nationally to go to the health sector, which is, again, quite challenging. I would expect that the government should be putting a bit more resources in health. And for that reason, a lot of support that we get is from donors, both at national and lower levels, which is great that it supports the health system and tries to eliminate the challenge of limited resources, but also has a challenge tremendous upside in recent years. If you look at the statistics 10 years ago and where we are, you would find that the number of cases of NCDs has increased, be it cancer, be it obesity or diabetes, hypertension. So whereas we still are grappling with the communicable diseases, the malarias of this like and diarrhea, now we have NCDs. The developed world don't, handle the malarias and diarrheas. They are focusing on NCDs. So if we had a problem 10 years ago, now we have double the problem. So again, effort has to be done to ensure that we address the communicable diseases, but now also put in a bit more effort on the NCDs, which, as I said, are quite important. There's a lot that Uganda can learn from neighboring countries, but also other countries across the world. And I can give very many examples of what we could learn from several countries. One of them is that if you can look at the community workers as an example, in areas where there's very low support to these volunteers, their performance is really low. Some countries have made a deliberate effort to strengthen the capacity of the volunteers or the community workers, including regular training, support supervision, ensuring that they are motivated, whether financial and financial. Another way we could think of learning from other systems is insurance schemes that are not necessarily overburdening the community, but still people are able to elsewhere, but more importantly, putting into practice what we know. For example, we as researchers at universities, we interlock with colleagues in other countries. So we have collaborators, different studies that help inform us regarding what others are doing. If you talk about ministers of health, again, there are several fora that the ministers have where they meet and share experiences between Africa, in Europe, in the US, and other projects. We have reached to where partners meet at that continental level. If it's WHO, again, we meet at the WHO regional office, but also at the WHO Geneva office. So at that level, there's also a lot of communication. Probably what is lacking is learning from local level, because if you look at a rural community as this one, it may not have a lot of links of learning, say, from neighboring countries. And one thing that we've done as an example of a local initiative is to have a WhatsApp group of community workers, which is coordinated by a colleague at the university. So this group helps the CHWs communicate amongst themselves, share experiences, learn from each other, but also have that information shared at national level. So as part of the group, they are members of HIFA, which is Health Information for All, which is a global platform of sharing information and knowledge. So information from the group is channeled upwards to that HIFA platform, but also the coordinator of the group helps channel information from the HIFA discussions right back to the community. And that is really one small initiative. I wish there was more, there were more avenues for such, information exchange between the local and the global and vice versa. That would actually, I think, do quite well, learning from other sales systems and supporting each other moving forward. If I wanted to target one critical area that I feel would really have a very strong impact on the health system in general, I would certainly target strengthening the community health system. Because if you look at where exactly the problem is, most of the time the issues are in the communities. We had a training today in this place, and the trainers who are health workers put a strong emphasis on household health. So what situation are we living in our communities? What sources of water do we use? Which food do we eat? Where do we dispose our waste? How do we keep our utensils? Because if you really target health at household level, you've done half of the problem. So if you, for example, invest a lot in the high-level health system in terms of national referrals and district referrals, yes, these need to be there, and they are certainly very, very important. But if you really forget and not put emphasis on the community where people actually stay, live, get exposed to these risks that cause the disease, and later on make them have to visit the health center, then I think you've not done a good job. So for me, my effort would be strengthening the health system at community level, but with a very strong focus on prevention and health promotion.
Wow. So any lessons learned? Class, over to you.
Yes, sir.
Yes, sir.
Go ahead.
Yes, this is Asiki.
Asiki, go ahead.
Yes, I really indeed learned something out of this video. One, okay, on issues of public health. Of course, I've realized that public health is really wider. Though we are talking about health promotion, it involves as we saw today, we have been dealing with partnership. We have seen that indeed, if we work as a partners, if we work together, we hold our hands together, we're able to achieve the health for all.
Excellent.
And it involves also the community, because for you to be able to realize something tangible as far as health is concerned, of course, the community needs to be brought on board, and they should be involved in any action that one takes. And it goes beyond issues concerning prevention of maybe diseases like maybe, let's say, malaria, because of distribution of mosquito nets and so on. But above all, it is really a comprehensive thing that does not involve working alone. Okay. That is basically what I can say about what I've said before. Though I joined it, I clicked on it late. That's what briefly I can say. Thank you.
Yeah, you can actually find it on Moodle and rewatch, and then you'll enjoy it. Yes, because the concept of community health workers is really very, very important for us to appreciate as health promoters. Yes, we are Ruhanga Godfrey. Your hand is up.
Thank you, sir. There is something I've learned about Mr. Musoke, and most times we normally focus at the curative means of trying to control disease in communities, but I've tried to listen to him when he's advocating for preventive, especially when we tackle the problem from bottom to top. You look at the communities, by the time you prevent a disease in the community, there is no way we shall have patients in the hospitals. And there's something you talked about, the household health, which is very, very important. As public health officers, when we try to control what people are eating at home, the type of water they are using, and we continue to advocate for good health and sanitation at home, there is no way we are going to have a lot of them presenting with the diseases in the hospital. So I think I'm learning that yes, curative is okay, but it is time to go with the preventing means of these infections which are coming in.
Okay.
Thank you.
And remember, Ottawa Charter reorientation of health services. Good. Rubega, your hand is up. Thank you very much, Yarhanga. Okay. Balugahara, sorry. Yes, Rubega.
Yes, I appreciate his teaching, but what we are looking at is the government. He was talking about the 15%, which was agreed by Abuja or something, but we see it not being implemented here. I think if we continue with the paperwork of designing the systems, and when they are not implemented, still it cannot help us better. And another submission is, yes, they are training these VHTs. But I'm looking at when these people are much more empowered, there is a need for a regulation that should be put in that these people don't go in now to do the other clinical work and they treat clients, because we have seen some VHTs near getting that kind of authority to manage some clients. I mean to make referrals, identify people with problems to go to the facilities, but they go in and they even reach at the level of setting facilities like drug shops. You find the others are admitting, and we have found some kind of tragedies alongside these people's kind of unregulated activities and supervision. Thank you.
Okay, that's very good observation, and I think when it comes to regulation, it is very, very important that they don't do what they are not supposed to do. So you find that some are registered even with clinics, as you were saying, and they are busy treating people in the community, yet they have never gone to school. They are volunteers who have come up and they give them a few skills, and what they cannot even perform, they end up doing it. But there are very many things that they help in, and very easily they are motivated to come on board and try to help us. Now, this one takes us to other forms of community health workers. Sometimes one may call them traditional practitioners, because and many times we talk about traditional medicine, people think of witchcraft, but you realize that witchcraft or a witch doctor is not taken as one of the community health worker, I guess. So we don't want to call him one of the community health workers. But the health practices, any approach, any knowledge and beliefs that is incorporating plants and animals together with mineral-based medicines. I talk of spiritual therapies, manual techniques and exercises that are usually applied either in maybe a single pattern or in combination with others to treat, diagnose and prevent any kind of illness or maintain the well-being of individuals is what we refer to as traditional medicine. But so any person who is recognized by his or her own community and is taken to be competent enough to provide any form of health care by use of local herbs, by use of plants, by use of animals, mineral substances, and any other methods based on their social and cultural ethos or religious principles, including their knowledge, their attitude and beliefs, pertaining to the physical, mental, and social well-being of individuals that are well known that in their community, they are so commonly saying that maybe there is a person, usually people get a weird condition, they get epilepsy, and someone feels like when you go to that person, it will recover. Regarding the physical, mental, and social well-being, and even the causation of that disease and disability. So it is always very important for us to recognize that these are traditional healers. And any person who is recognized by his community and he probably uses native drugs, knowledge, that was handed maybe down from their generation to generation. They got them from their ancestors, their grandmothers. Either they gave them orally or they are through spiritual means, communication with ancestral spirits. They usually through dreams and possessions. They tried so much to alleviate all forms of human suffering. And the traditional and modern health practitioners together against AIDS came in to come up with such a definition of a traditional healer. There are many categories of traditional healers that we know. We have specialized categories like herbalists, traditional bone setters, we have traditional birth attendants, we have traditional mental spirits specialists, spiritualists, faith healers, diviners, reflexologists, acupuncturists, and yoga practitioners. But of course, the VHTs are taken to be more of in the health sector because they try to take them to the modern medicine. But you will realize that there are so much involved in community health workers. And soon one would adopt and pick some people and they will be trained maybe in such a way that they can be able to be recognized, and probably I doubt whether they will ever enter salary scale, even when the nursing assistants were scrapped. I don't know whether the nursing assistant, do we still have them in on the payroll?
Yes.
Okay. So there are some of them.
They are
No?
not there.
They are not there.
They are still on the payroll.
Because when I go to...
They are there, but they are not, they no longer look. The old ones are there.
The old ones are there. They give them, yeah. But because whenever I go to those facilities, I normally find people in, is it, which color is that?
Purple.
Is the purple, eh? It's called purple. Okay. Now, for the herbalist, who is a herbalist? Anyone who has acquired an extensive knowledge of magic, magical technique, and who do not typically possess occult powers. They don't have these occult powers that he can see you, he can sit on a hide and he sits on water, a hide and skin, and sit on water and doesn't sink. Those ones don't have occult powers. He's an herbalist. For him, he's like an, how do you call it in pharmacology? A pharmacogonist, isn't it? For him, he looks at a plant and says, this one can treat malaria. They use mainly herbs, the medicinal plants or parts of those such plants. Either they can get roots or stems, leaves, stem barks, or root bark, flowers, fruits, seeds. But sometimes animal parts can also be gotten by them. Small wall animal, snails, snakes, chameleons, tortoise. And you've seen how this, the one you are calling witch doctors, they tie these hides, they get a lizard, they dry it, they tie it in a piece of cloth and say, that you tie it around your waist, you will get a baby. And then you tie that one, you will pass exams when you put on this one as maybe your necklace. Then you put on something, but they have tied a lizard there which is dried. Inorganic residues can be used, alum, camphor, salt, and others, and even insects and bees. Okay, the black ants can also be used. They can be added to these drugs. And they normally administer it in the form of powder, which could be swallowed or taken with the pap, or cold, or hot, or any drink. So powder can also be used, but they tend to rub it in 2 cuts. They cut you in your head that you are going to get wisdom. They cut and put there some funny things which are irritating, so that you are getting knowledge. You remember how we used to pick knowledge from our friends? You pick his hair and put in yours. Made on any part of the body with a sharp knife. They cut. And when you want to know that people have ever gone to these herbalists, you just look at their chest one time. You'll be able to see some stretch marks, cuts. Those people were given such herbs. Preparation soaked for some time in water or local gin, maybe decanted as required before drinking. The materials could also be boiled in water, cooled and strained. Then we see preparation pounded with native soap and used for bathing, like medicated soaps, which are commonly used for skin diseases. We see pastes done, pomades, and ointments in a medium of palm oil or shea or butter. Others even use soup, which is commonly consumed by patients. All right. So usually we have bone setters. Those are used. I've even had those ones. You are in Kunjiri, you just go there once, then you go back to Kabari, or you come back to Kampala. They tell you at 2, we are going to work on you. Make sure you are seated in a sitting room where you don't have anything that will injure you. So the bone setters will try to compress a tree, and you're not seeing the person to tell him, please stop, I'm feeling pain. So they are normally known as the local orthopedic surgeons, because they use the art of pairing bones and other orthopedic injuries that the people get. These are bone setters. So traditional bone setters are those knowledgeable in the art and skill of setting broken bones in their traditional way, using their skill to see that bones unite and heal without using a POP, plaster of Paris. Okay? And Jimmy are saying that is just witchcraft. They deal on simple, compound, or complicated fractures. wounds resulting from such fractures are usually cleaned and bones are set, making sure that the ends of the bones tend to unite properly to prevent any deformity. So the bleeding is usually stopped on application of certain plant extracts, basil or cassava leaf extracts. Some people put their giant snail's body fluid, and others put their, it is even common to use banana leaves as lint, so that they stop from bleeding. Then the TBAs, these are the ones who are traditional midwives, traditional birth attendants. We have community midwives, so sometimes people call them like that, or a midwife, a person who assists a mother at childbirth and who initially acquired her skills delivering babies by herself, or she got it from the ancestors or from apprenticeship. The aunt used to do so, the mother, so she took up the skill with other birth attendants probably. And their role is to attend to mothers who are delivering, but some of them even give them local herbs, mumbwa. They just get herbs and mix it with kile, and then they give the person. There is the one which breaks the bones, the one which is for younger one, the one which is for older one. So they call it ento and kulu. So the message is bathing and massage, and then they do domestic chores. They help those mothers who are pregnant and support them at home, and provide care during the postpartum period or postnatal period. But traditional psychiatrists, these ones are the ones who are specializing in mainly the treatment of lunatics and those with mental disorders. They give them herbal hypnotics and the highly sedative herbal potions to calm them down, just like what mental nurses or mental clinical officers do, and give them the drugs. But we have those who are called diviners. The diviners are believed to be intermediaries between humans and the supernatural ones. This one, they don't become diviners by personal choice. They are always say that they were called by ancestors and they are servants of these ancestors. These days are now the spiritualists we are going to see. There are those who call themselves the prophets, that they were called by God, and they tell you what you did last night and with who at what time and why you did it. Diviners concentrate on diagnosing the unexplainable. They analyze the cause of the specific events, and they will interpret it, and they will give you the message from their ancestors. So you do what they were saying, because they use divination objects, and they even explain the unknown by means of their particular mediumistic powers. But they say, although their vocation is mainly of divination, they often provide the medication for the specific case they have diagnosed. But they are diviners and also have spiritualists. These are spiritual healers. For them, they diagnose and they treat patients by spiritual and divination practices. Actually, they use ancestral worship and report possessions by a number of traditionally known healing spirits and deities. So their healing activities are usually performed by the healer as the spiritual mediator, and they mainly attend to the psychosocial cultural issues, and those are the spiritualists. Then there are those who are reflexologists. They tend to use a specific thumb, yes, because of reflexes. They touch certain part of, if you remember the limbic system, they touch the certain part of the body, like on the foot. They know this part of the foot is pertaining to this organ. So when they touch and you feel pain, then the liver is the one which is sick. They give you diseases, drugs for the liver. So the fingers and the hands technique, without the use of oil, to apply pressure to the feet and the hands or areas. So they massage even such a way that. So they claim that it is based on the system of zones and reflex areas. that reflect an image of the body on the feet and hands, which are the premises that such work affects the physical change to the body. So they become reflexologists. Now, you will realize that they don't have consensus on how it really works. Each of them does his own thing, and actually some of them have started undergoing training and have harmonization of the thing they're doing. So their unifying theme is the idea that areas of the foot will correspond to areas of the body, and that by manipulating these ones, you can improve the well-being of an individual, one's energy flow. But they are criticizing them so much because they don't have evidence of its claimed effects, and they are not taking them to be so scientific and demonstrated the basis for their theories. And they don't have proper central regulation, and they are not accredited or licensed anywhere. They are very short medical training sessions which they give them so that they can pick. But you've seen Chinese where they pierce themselves with small needles and pins on the body. They presume that they reduce pain. Those are called acupuncturists. They treat their patients by inserting and manipulating the needles on the body. And they claim to heal various ailments like relieving pain, treating infertility, and even prevention of disease while promoting general health. Those of you who have ever gone to Chitagata, who has ever gone to Chitagata? Is it Chitagata Hot Springs?
Yes.
People go there and sit there with various diseases that the water will heal them, okay? So I don't know how we shall call that one now. Okay, so we need to, you can try to explore more and read about these traditional health workers. Yes? His network is poor. I'm not getting him. Did you get him? Paulo is saying that they are also called safe motherhood promoters. Yes. Paul, why did you say fire? You're a Christian. You are chasing others with evil spirits. Fire. I think you are from this Pastor Senyonga's church. He's the one who is fire. Okay. But do you think these community health workers are helping us in promoting the health of individuals? More so the traditional healers, leave alone the VHTs that we have seen as community health workers, but these others, the herbalists, do you think they are doing harm than good as we are concluding?
Thank you. Personally, I think they are doing a great job, only that they are failed to be given enough time and research to understand what they are doing. And I think it's deliberate, because once they are, you realize that we look at these pharmaceuticals as we learned in pharmacology, pharmacognose in particular, realize that all these drugs we're using in the pharmaceutical area and everything, realize they have a basis of these roots. And these local people,
We have lost you, Dennis. Derek.
I was saying that it's deliberate that this knowledge is hidden in that way that they say we do not understand. Yet they come and do their research undercover. They realize those trees these traditional people are using. What they do, they get those trees, they take them to their labs up there, they generate drugs, and they start even selling it to others. And for us, in our, I'll call it lack of knowledge, we praise them. Yet not knowing that if we give enough research and funds to dig down and find out what really these people are doing, I believe we can have a lot of more knowledge and independence concerning the treatment and medicines. And then the other thing is that most cases, what we don't understand, we usually fight it. That's the problem. Instead of trying to find out what is really behind that. We talked over the spiritual, the magic. Actually, the magic, it's not magic. It's just a matter that people don't understand how it works. And that's why they call it magic. But I personally believe that there is always something behind everything. When you look at mothers taking this called mud, when they did research, they found some quantity of iron. When we had a problem with the people with sickle cell who had low blood and so on. We realized that one of the mothers came in and told us that you boil the leaves of the avocado. When we did it, we realized that the children improved and we need not even give them folic acid to enhance their red blood cells. And it worked very well. But realize that you come to someone can say, no, it can't work for me, I prefer folic acid because it is approved by the NDA and FDA. But realize that it's just a matter of giving it time, resources, research to get it done. Thank you very much.
Okay, thank you very much, Derek, for that. I think it is a good supplementation and I think a deliberation on that observation, and you're quite aware with that. Any other observation? What have you seen with these community health workers? Would someone really, and the more so these VHTs, would you think they would be given official training so that even they are recognized and supported? Because I see they do most of the work. Okay, because Derek is late. Maybe we can discuss that one tomorrow. How do you see it? It's already 5 and we are exhausted. So I would think if no other hand up, we can stop at this point. I thank you very much for attending. Will that one be okay, Derek?
Thank you.
Yeah, tomorrow we shall be looking at behavior change theories and models.
All right.
Great. So I want to wish you a good night. All right.
And pray for Manu.
You want to pray for Manu?